I'd like to know, like, what led you into the medical field, and then also what led you to this talk today?
Yeah. So thanks for having me. I'm kind of from a medical family. My mom's an RN, and my dad is a retired anesthesiologist. So I kind of grew up in a medical family. So medicine was always kind of an option for me. It wasn't seen as something that was out of the ordinary. And what I love about medicine and what's has always been a really good fit for me is it's a really beautiful combination of science, which I just love, and numbers, which I love. And we're going to talk about some numbers today. And also working with people and kind of ushering them through some of the hardest moments of their lives. So I'm an internist. I'm a board certified internist, which means I specialize in adult medicine. I'm not a surgeon. I don't deliver babies. I don't see kids. And I really love working with adults, especially older adults. I didn't do a fellowship in gerontology, but I certainly specialize in seeing seniors. And so this company and this role has been incredibly good fit for me. So I was telling Lisa when we were talking about this yesterday, I remember the exact date that the CMO of Intermountain, Nevada, Dr. Broby, called me. It was March 10th of last year. So 5 days coming will be at a year. And she called me up and she said, "You've heard about COVID?" And I said, "Of course." And she said, "I want you to be lead on all clinical activities having to do with COVID." And I said, "Sure." I had been reading as much as I could up until that point. And so on March 10th, 2020, I became an expert in all COVID activities. And so obviously we've learned a whole lot in the last year. We're still learning a lot. And so I hope for the next 45 minutes or so, we can answer your questions about what's going on with COVID vaccination specifically, but COVID in general. And whatever I say today is going to be old news by next week. This is an ongoing story, and it's really very dynamic.
Wonderful. Thank you, Dr. Ford. Would you like to go ahead and start your presentation now?
Yeah, let's start.
All right.
So I've titled this Mythbusters because we're going to be kind of challenging some of the myths that I've heard in the community that you might have heard from family and friends. But again, when we hit the Q&A, any questions you have are absolutely okay. So next slide. So I like to always kind of set the conversation when we're talking about vaccine about risk. So everyone's risk of serious illness, hospitalization, or even death from COVID-19 is not the same. And this little infographic from the CDC I thought was very powerful. 8 out of 10 deaths due to COVID have been in older adults as defined as 65 and over. So this disease is absolutely not kind to older adults. And there's a lot of reasons for that. We can talk about that. But everyone's risk is not the same from being severely ill from this virus. Next slide, please. So again, I'm a numbers person. If you're a numbers person too, this might speak to you. So same concept, but really kind of crunching the numbers. So as compared to young people, 18 to 29, which, don't have a lot of hospitalization and deaths due to this illness. You can see as you go up into the different demographic bands, and I'm in that 40 to 49 band, at least for another couple months, my risk is 3 times higher of being hospitalized and 10 times higher of dying than my 18-year-old children. So this is really powerful stuff. I'm not sure I can get my head around folks 85 plus who are 13 times higher to be hospitalized and 630 times higher to die. But it is, I'm not sure I can get my head around that myself, but it is very powerful to demonstrate that older adults are absolutely the people most at risk. Next slide. So what makes a person high risk? we've already said age in and of itself, even a healthy 80-year-old person is at higher risk from serious illness than a 16-year-old or an 18-year-old. But there are also again, what we've learned in the last year is there are very specific conditions that put us at high risk at any age. And so this is a list that the CDC developed to indicate higher risk. And the state of Nevada is following the CDC guidance on this to define high risk conditions. Cancer makes sense. Your body is fighting a cancer and maybe having very serious medications to treat cancer that weaken the immune system. Chronic kidney disease of any stage. So if you've been identified as having chronic kidney, that puts you at higher risk for serious illness. Any lung condition, chronic lung condition. In our seniors, we see a lot of COPD, but certainly our younger patients with asthma, cystic fibrosis, lots of other lung conditions would put you at risk. Down syndrome, heart conditions, including heart failure, any sort of cardiac disease, including heart attack or angina. Hypertension, just hypertension, puts you at a higher risk of severe disease. And of course, having suffered a stroke or a baby stroke, which is like a TIA. Sure, solid organ transplants, same reason. They're on very powerful medications to suppress the immune system, and therefore the coronavirus could absolutely cause more severe disease. Obesity, in and of itself, being obese is a risk factor for more severe illness. The CDC set a BMI of 30. Now, BMI is a measurement of your height versus your weight, and you can go onto the internet and type in what's my BMI and put in your height and weight and calculate your BMI. 30 is the definition of obesity. It's not a great number. It doesn't talk about muscle mass or also male versus female, all sorts of stuff, but it's a really good rough number, and it does absolutely correlate to risk. Pregnancy. So pregnancy is a very interesting physical state where the mom is actually carrying a baby that's half not hers, right? Half not her genetic. So the immune system is definitely altered in pregnancy. Sickle cell disease, smokers and former smokers, again, damage to the lungs do put you, this is primarily a respiratory disease, although it has a lot of fallout. But it's coronavirus, COVID-19 is primarily a respiratory disease. So those are the conditions. Next slide. Okay, so let's talk vaccine. So we now need a chart. We didn't need a chart before, but now we need a chart to keep it all straight. So these are the 3 current vaccines that are FDA emergency use authorized in the United States. So it gets very confusing when you talk about globally, and we can talk about globally. But these are the 3 that our United States FDA has said the data is compelling to release it for emergency use authorization. So the first was the vaccine manufactured by Pfizer and BioNTech. The type of vaccine, and we can talk about types if people have questions, is an mRNA vaccine. It does require 2 doses to get immune, and the timing between those doses is 21 days. It is FDA approved or emergency use authorized for folks 16 and over, and it received that emergency use authorization on the 11th of December. Right in back of it came the Moderna vaccine, also using the same technology, an mRNA vaccine, also requiring 2 doses. The time between those in their data recommends 28 days. That one, they only studied 18 and up, so they didn't go for approval. And that's my dog, I apologize. 18 and up for approval, and that was approved just a week after Pfizer on the 18th of December. And then finally, the one that was a big splash in the news last week, the Johnson & Johnson Janssen vaccine, different technology, an adenovirus vector vaccine. This one is exciting because it's a single dose, and we could talk about that, but it is exciting, right? Because one and done, we like that. Again, received emergency use authorization for 18 and up. They did not submit data or try for younger. And that was just approved on Friday. So that's exciting. A week ago today. So that's exciting. So those are the 3. Okay, so let's talk about the myths and the reality. So I hear these every day, and you might have heard this too from your family and friends. So, well, I don't trust this vaccine. It was fast tracked by the manufacturers, and it couldn't possibly be safe, right? They didn't do enough due diligence on the safety. And of course, I've now become an expert on vaccine development. So there are certain phases that the FDA insists upon to develop a vaccine, and all the phases were absolutely done for all three of these vaccines. But instead of being done in series, so first step one, then step two, then step three, they did a lot of these things in parallel. So that's why, as of Sunday, they started shipping Johnson & Johnson vaccine, because they didn't wait for emergency use authorization to start manufacturing it and boxing it up. So ordinarily they would have waited, right? But so they've done a lot of these processes in parallel so they could get the vaccine out faster. If you're a data person and want to look at the data, it is all completely transparent on the FDA website. So you can see what the FDA saw, and it's pages and pages long of data. So there's complete transparency on this process as well. Okay, next slide. The vaccine uses new vaccine technologies, therefore they aren't safe. So this was a big deal with the mRNA vaccines when they were approved in December. These mRNA vaccines are the first of their kind. And right, there's two different ones, two different manufacturers, Pfizer and Moderna. However, the concept of mRNA-based therapeutics are over 7 years old. And so I remember reading articles 5 and 7 years ago about kind of how mRNA was going to change medicine. And so the cellular biology and what we understand about mRNA technology is very well understood. The adenovirus DNA vaccine, the Johnson & Johnson one, was used for the Ebola vaccine, which was FDA approved 2 years ago. So it is a newer technology, but certainly not brand new. It's already been in one vaccine. And again, we can talk about that more if there's time in Q&A. Next slide, please. I get this one a lot. You know, if I get the vaccine now, I'll be a guinea pig. Let others get it first, see how they respond to it. Well, they have, so we're there. This data was from the CDC. As of 3 days ago now, 78 million Americans have received at least one dose of the mRNA vaccines. Obviously, Johnson & Johnson is not a player yet. And so that's 20% of the population 18 and over have received at least one shot. 10% have received 2 shots. So that's where we are on vaccinating our population. So this is obviously a now well understood vaccine. We understand the side effects. We understand what to expect. So you are not a guinea pig if you choose now to be vaccinated. Next slide. And this is what I was trying to kind of set the stage for. This myth I get a lot is, you know, the recovery rate is so good. I'm just going to take my chances with the disease. Better to get the disease than to be vaccinated. And I remember back in the chickenpox days, right? Mothers would say, I'm going to let my kid get chickenpox rather than deal with a new vaccine. You know, chickenpox vaccine now is 30 years old. But I remember that 30 years ago. And while it's true that most people, 80% of people, have mild disease, which is defined as you stay at home, you feel punky, you return to kind of normal life after 7 to 10 days. We now know a lot a year later that as many as 35% of people have illness that extends beyond 2 or 3 weeks. So there was this massive study done in 13 centers all across the country, everywhere from California to Boston, interviewing patients. And at 2 to 3 weeks, 35% of people said they were having continued problems, chronic headaches, trouble concentrating, brain fog, sleep difficulties, who needs that, chronic rashes, diarrhea, who needs that, fatigue, shortness of breath, racing heart, the list goes on and on. And so even to younger and healthier populations, when I talk about the vaccine, who needs that, right? And we're not even talking about what they call long hauler COVID, which is after 3 months of symptoms. And that's even more, severe. But so, so who needs that? Nobody needs that. Get the vaccine. And that's the the quote if you want to look up that study on the 13 centers when they interviewed patients. I like to always put my sources in. Okay, next slide. This is another myth, and I think maybe this is going away. The Biden administration has tried really hard to reassure the public about this, but there won't be enough vaccine for my second dose. So why bother getting a first dose if I can't get the second? And so it is true that the federal government, the US government, gets the vaccine and then they disperse it to the states. So the state of Nevada gets it from the federal government, and then the state of Nevada deploys it to local vaccination sites. And especially in the beginning, we were very disappointed that Nevada wasn't going fast enough. As I mentioned, about 10% of the US population has received at least one dose. Nevada's right in line with that. We're right average now. Yay, let's be average. So the state of Nevada is about 10% of our population, 18 and over, has received one dose. And I'm sorry, 20% has received one dose and 10% has received two. And the supply keeps coming. So we did hit that little bubble when the weather got poor and there were some issues around supply, but the vaccine keeps coming. And so we have never had a continuous problem with that. It does keep coming. So most centers now, when you receive your first dose, you do get an appointment for that second dose, and they've saved it for you, which is great. Next slide, please. So I did want to throw this in. This is not about vaccines, so thank you for indulging me. This is about antibody treatment, and I'm a huge advocate for this, so I really wanted to, when I'm doing any community talk, really want to advocate for this. So for months and months and months, we had nothing to offer people for outpatient treatment. Remember, there was hydroxychloroquine, and that was not right. And there was, do I take vitamin D? And there was all sorts of home remedies that people were recommending. We never had anything to offer people who were home and sick. Well, we do now, and we've actually had it since November. The first drug was FDA approved in November. It's monoclonal antibodies. So the concept is we're giving people antibodies before they can form enough antibodies to fight the disease. So we give it early in high-risk people, so they don't get sicker and don't end up in the hospital. And so this product, bamlanivimab, I've been practicing, bamlanivimab, which is made by Eli Lilly, was given FDA emergency use authorization in November of 2020. And the studies, and again, you can look up these studies, show that patients who receive this within 10 days of their symptoms have less emergency room visits, less hospitalizations, and of course, ultimately less death. And they feel better. Which is good. We want that without any serious adverse events. This monoclonal antibody treatment is what President Trump got when he got COVID. He received a monoclonal antibody treatment. This is now available for all of us non-connected, non-rich people, and it's being infused free. The federal government gave Sunrise Hospital a grant. At Sunrise Hospital, they have a tent right next to the emergency room, and they're doing this. So if you or one of your loved ones are high risk, they have those chronic conditions, they're over 65, they should absolutely talk to their doctor to be referred for monoclonal antibody treatment. It does require a doctor's referral. And so we have, my company, Intermountain Healthcare, has been referring all of our positive patients who are eligible, who are over 65 or chronically ill, for infusion. And so I did want to kind of get it out there because it's not kind of widely publicly known, and I'm a real fan of it. It is an infusion, an IV medication that you get for about an hour, and then you go home. And I'm happy to talk about that more, but I always want to put that into any community talk I give. So that's the monoclonal antibody treatment available to you and your family. Next slide, please. So Intermountain Healthcare, we are one of the biggest groups here in Southern Nevada. We are vaccinating our patients with the Moderna vaccine. That's the vaccine that the state gave us. So if you are an Intermountain Healthcare patient, we will get to you eventually. We have not received as much vaccine as we would like. So we are doing outreach to patients based on the supply we get. So I can't give you a number to call to schedule. You will be outreached by our vaccination team when there's a dose available to you. So we are vaccinating when we get it from the state. And there is, if you're interested in what we're doing with the vaccine, there's the website address. So that's it for my formal, I always talk faster than I think I'm going to, our formal comments. Plenty of time for Q&A, or I can go back and talk about one of the slides I went too fast through.
So thank you so much, Dr. Judith Ford. Like I said, I was so excited to have you on here for this talk, knowing that you're considered an expert in this this whole COVID stuff. I've seen you on the news. It's been my pleasure to have you today. I wanted to let everybody know, one of our attendees said that they're having problems with the public chat. You should be able to chat the host, which is me, privately. Would somebody please confirm that you can send the host or the presenter a chat, and we'll get this started. Okay, our questions are coming in. Dr. Ford, we have had COVID in December. Can we get the vaccine? Should we get the vaccine?
Yeah, so that's a great question. So having the actual illness, a person develops antibodies, and so there is a protection from actually having the disease and surviving the surviving the disease. So we don't know how long that protection is for. So the CDC has set a kind of a guess at 90 days. It's probably longer. But it's at least 90 days. Okay. So if you had the disease, let's say November 15th, January 15th, February 15th, March 15th is when I would seek the vaccine. So once you've made it past those 3 months of assumed protection, now the reality is you probably still have a little bit of protection left as well. But yes, you should seek the vaccine 90 days from when you had COVID illness.
Perfect. I have typed in here. If anybody else has any questions, please enter them into the chat and direct it to the host or the presenter. I'm just going to wait a little bit longer. What are some of the questions that you have been getting out there in the field?
So people have a lot of questions about side effects. And the nice thing is you probably have neighbors and friends who have gotten the vaccine. So there's that's kind of settled down a little bit. So side effects are really unique to the person and how they respond to the vaccine. Almost everybody gets a sore arm, right? Like a flu shot, you'd expect a sore arm. But others can get low-grade fever, aches and pains, headaches, and these are the mRNA vaccines. Although the Johnson & Johnson vaccine has the same in their data, but just nobody I know has gotten the Johnson & Johnson vaccine. The second vaccine of the mRNA vaccine, the Pfizer and the Moderna, seem to have more side effects because your body has had a little bit of a primer, and so your immune system is going to be even more robust. So if you're going to have more side effects, it would be on the second shot. The good news is these side effects usually only last a day or two. So they're very short-lived, and you kind of know they're coming, and you kind of take it easy and take a little bit of Tylenol and you're fine. So everybody's a little nervous about side effects. But again, even if you were going to have side effects, they'd be gone in a couple days. So I get a lot of questions about side effects. Yeah.
Great. So we do have a few more questions coming in, and sure. I'm excited about these. What is the estimated ETA for outreach? Should I call my clinic? I'm presuming they are an Intermountain Healthcare patient. Also, why shouldn't I consider the pharmacy free vaccines?
So I would absolutely not wait for us. We have not gotten enough vaccine to vaccinate the tens of thousands of patients we wanted to. So I would absolutely 100% not wait for us. The vaccine is really widely available in the community. So the second part of the question I don't understand. I would definitely go to Walgreens and get it. Yeah, or Smith's. Walmart is starting to give them now. There are community centers. The Doolittle Center is a really good experience, I'm told. I have a neighbor who went to the Doolittle Center and got theirs. So I would not wait for Intermountain Healthcare to call you. I would go to one of your local vaccination centers and get it. We have not gotten the amount that we wanted. So I hope that answered the question. Yes, go to the pharmacy. Yes.
All right, we have another question here. What is your view of when we reach herd immunity levels?
Yeah, that's a great question. So nobody knows for sure. The number is about 70 to 80%. Is the number. So it's, simple math. It's the number of people vaccinated plus the number of people who have been infected. As one of the folks said, I had it in December, right? So that person who had it in December would be in that number already as having some sort of immunity. So you would add the number of vaccinated plus the number of infected. And so that's the number I'm looking for, right? So it's 10% right now. We're trying to get to 70 to 80%. When we're going to get there, it just depends on how quickly we can vaccinate. Again, the Biden administration said by May. I think that's super aggressive. I'd be happy if it happened. But that's the number we're looking for, 70 to 80%. My dog is very upset about it.
All right, we have some more questions here. These are great questions. My sister had COVID and her doctor said she wouldn't get it again. She feels she doesn't need a shot or the vaccine. What should I tell her?
So again, I don't know when she had that conversation with her doctor, because we're learning, right? Because nobody had this disease before 2020. So, like I said, we believe you are covered for at least 3 months. But as this pandemic goes on and on, we are seeing people get infected a second time. At 6 months or at 8 months, because we're that far out now that people got it last spring and are now getting reinfected. So we are seeing it. We're seeing it in our patients and our employees, not a ton, but every once in a while. And that's because of the variants. We didn't even talk about the variants, but there is enough mutation in this virus over time that your immunity may wane to one variant and the other variant can take hold. So it absolutely is 100% possible for you to have reinfection. And I would seek vaccination once you're 3 months out.
Perfect. I have another question for you. We have an engaged group today. I have received both doses of the Moderna vaccine. Woo-hoo. The day before, congratulations. The day before I had the second dose, I hurt my back and I took ibuprofen that morning that I received the shot without realizing I shouldn't have done that. Does this mean with regard to me being fully protected, or what does that mean?
Yeah. So, right. This is a very sophisticated question. So there is a theoretical risk of kind of blunting your immune system if you take non-steroidal anti-inflammatories like ibuprofen. It's incredibly theoretical based on really old data from pediatric vaccines. So I honestly don't think one dose of ibuprofen is going to change such a powerful vaccine. Remember, the Moderna vaccine, 95% effective. We have never seen the likes of that. So I don't think one dose of ibuprofen significantly will have changed your response to the vaccine. But yes, there is a theoretical risk of not being able to build as a robust immune system, immune response. But honestly, I think it's quite minor.
All right,
but great question. Great question.
Right? We've had some really good ones today. I don't have any more questions. Oh, I have a few more popping up. I wanted to ask you too, and this question is from me. I'm just curious. So all of us who have gotten the vaccination have signed up with that Be Safe. And I'm just wondering, to someone like yourself, do you have access to that data? What's going on with Be Safe?
That's
Okay.
through the CDC.
Okay. I was just curious.
Yeah.
Okay, I have
CDC.
another question.
Yep.
Okay. Here's a good one. How long will Moderna last in the system?
Yeah. Well, the vaccine's gone after a couple of days, but what you really mean is how long am I immune, right? I don't know the answer. Again, new vaccine, right? There's never been a person on the planet who's been vaccinated for more than, where are we at? 3 months now, right? Because it was approved in December. So we don't know. We will likely need a booster at some point. Again, because of these variants that have popped up. So my guess is we will need a booster. Whether or not we will need a booster in 6 months or a year, I don't know. But the short answer to that question is just no one knows. In terms of what's going on with the variants of concern, that's the phrase, by the way, variants of concern. There have been 7 cases of the British variant identified in Nevada, and 1 case of the South African variant identified in Nevada, and none of the Brazilian variant so far. So these variants of concern so far are minor players. They're not major players like we feared so far. But my guess is that we will need a booster at some point in the future. And, if you have been vaccinated and you have your card, there are lines for boosters. So I think the CDC knew that was a possibility when they created those cards.
That's interesting. I have another question for you. My husband has had both shots. He's 77. I'm 64, and I want to get the shot. I take care of him. Any thoughts on how I can protect myself besides a mask and washing hands?
That's it. And not going out. Yeah. That's it. Right now the state is vaccinating 65 and over. We're all waiting for them to make the switch to chronically ill patients, because we all have patients who are sick and under 65 who need protection. But there's not a whole lot you can do at this point. You can try to scoop up a dose that would have gone wasted. So there's a lot of kind of gamesmanship going on. If you go to Cashman Center very early in the morning, you can be put on a list for waste doses, and then if you go back, you may be able to scavenge, if you will, a dose that would have gone to waste. So you can try to play that game with Cashman. I have had some friends who are younger than 65 have some success with that. But if it fails, it's not my fault.
I've actually heard.
Yeah. It's a thing, and we don't want any doses to go to waste, right? And because the vials have 10 doses per vial. So once you crack a vial, you have to use all 10 within 6 or 8 hours. So if it's at the end of the day and they have a couple doses extra, rather than let it go to waste, they will vaccinate people who are younger and healthier. But it's just all about timing and luck.
I say also volunteer to help out at those sites. They need help signing, like getting people checked in and stuff. Volunteer.
Well, I didn't even think of that.
I believe that is our last question. I'm going to give it just a few more seconds, but I do want to just say thank you so much. That obviously there was a lot of questions and concerns on this vaccine. We had a lot of engagement for this talk, and I just wanted to say, is there anything else you'd like to tell us? Any closing thoughts?
I would say, and I didn't actually, this is not a unique idea. Our Intermountain Healthcare president said that, I'm trying not to be too hard on people who weren't ready to get the vaccine initially, and you may have friends and family who are hesitant. I'd rather them get it eventually. So it's okay if people are late yesers. We don't say people, declined it or refused it. We say they're late yesers. And some people are that. They're just hesitant of new technology, and they're fearful. And so we just need to support our friends and family, especially the ones those who are most vulnerable to get the vaccine. And I think there's a lot of information now that these vaccines are safe and incredibly effective. I mean, 95 and 96% for the mRNA vaccines is unheard of in vaccination history. So they're very effective shots with pretty minor side effects for the price of that level of immunity. So I would just say, help your family and friends be late yesers.
That's wonderful. I have one more question, and this is a good one. Does blood type play a role?
Yeah. So this is one of those things that came up kind of early in the spring. All sorts of things about who is at higher risk. So yes, there was a study that was done that says certain blood types are more vulnerable to more severe disease. Why that is, I can't say, but it seems to be true. We can't do anything about our blood type, so I'm not sure. It is kind of interesting, but it doesn't really. You can't do anything about it. It's not on that list. So it's not significant enough that it would make you somebody who would jump to the head of the line because you're, type B or whatever. But yes, it does look like certain blood types are more vulnerable than others. And again, more to learn about why that might be true. Also, vitamin D deficiency seems to be a risk factor for more severe disease. So if you are vitamin D deficient, if you've had that blood test done, you should absolutely make sure you're supplementing. Now, that doesn't mean that everybody should run out and mega dose on vitamin D. If your vitamin D level is normal, you're fine. But I personally am vitamin D. A lot of us are. And so I do make sure I take just my regular supplement to make sure my stores are normal.
Wonderful. Well, I believe that was our last question for
Great. Well, like I said, the information keeps changing. So if you bring me back again, I'll probably have more stuff to tell. So I'm happy to come back anytime you want.
Wonderful. I'd love to have you. I'd like to thank everybody for coming and meeting